And, and yeah, we had been through so much, and I'm like, I know people, they genuinely care and they they want to help, but it was like, those comments like, "Oh, just relax. You're gonna get pregnant," or "Go get drunk and you're gonna get pregnant," and "This is what happened for me." And I'm like, "Yeah, but everybody's so different. It's not gonna necessarily be the same." And so, yeah, it was like, I get these people trying to help, but you're making it worse.
Welcome back to another episode of Beyond the Birth Story podcast. If you are joining for the first time today, I'm your host, Alexis C. Girl mom, angel mama to one of the sweetest boys in heaven, birth trauma and uterine rupture survivor, and former NICU mama. Here you will have the opportunity to ask and have your burning questions answered by professionals, feel connected to other women's experiences as we normalize the different aspects of this journey we are on as moms. The real and raw moments of healing are shared here as we navigate loss, embrace strength, and find hope again while learning to live after loss. Please note the topics discussed on this podcast are for educational purposes only. Please see your personalized medical professional if you have any questions or concerns that arise from listening, including diagnosis and treatment. Well, first and foremost, I just want to thank you for being willing to share your story. I know so many personal people in my life, and then obviously just coming across women day to day that have struggled with infertility or have gone through fertility treatments, considering them. And every one of them says it's so isolating. And
Yes.
so having someone that's willing to share their story, and I think you have a very unique perspective where, it wasn't kind of just that fairy tale ending where you transfer and you get a baby, right? So I really,
Yeah.
really appreciate you taking the time to chat with me.
Oh,
With that being said, whatever you're comfortable sharing, do you want to just give us a little background on who you are?
yeah, for sure. So, my name is Janine. I am actually a regulated pharmacy technician, so healthcare professional at the hospital. I've been there for, gosh, it's been like 15 years or whatever. It's been a long time. So that's kind of what I do professionally. I also have two beautiful girls now. Both are IVF babies. So one's 10 and one's 5. Um, yeah, and we just want to live here in Wainwright on an acreage just west of town. And our hockey is kind of our life. I have both girls in hockey. My husband coaches them both, and so that takes up a lot of time.
Seems to be the norm around here. Everybody's running for
Yeah,
hockey 7
yeah,
days a week, and
yeah,
that's amazing.
exactly. Hmm.
So what kind of was your IVF process like, or your trying to conceive journey before you decided to try IVF? What did that kind of look like?
So we actually didn't really try for very long. I don't, most fertility clinics will say you need to be trying for a year at least before we will even consider you. But I remember going to Dr. Visser and I was just like, something just felt off. And I'm like, I'm not getting pregnant. Why am I not getting pregnant? And I don't know. I was quite young, like early 20s. And I don't know if he felt bad for me or what, but he just like instantly referred us to the fertility clinic. Like there was no really big issues at the time. It was just like, oh, just could not get pregnant. And so he's like, I'm just going to refer you. And within 4 months, we got in. Like, we didn't even have to wait a year. And they just took us, started
Wow.
testing. Yeah, like, I guess we were one of the lucky ones because it was just, anybody I had talked to, they're like, oh, if you're not pregnant, by now, like, get the ball going. And that's exactly what I did. I just like, I didn't know that anything was actually wrong. It was just like we just could not get pregnant.
Mm-hmm.
And so we actually got referred to Edmonton. So at the Royal Alex there was a woman, but it's now closed, but everything kind of went private. So we got in, just kind of went for our first consult, had all the testing done, um, and just dove right into like the Clomid, the fertility drug. Um, the doctor, she said, just take this and we'll just see if you get pregnant off that. Well, she took my blood work and she's like, oh my gosh, like I didn't get pregnant. But she said she said I probably would have had multiples because ovulation was not a problem.
Mm-hmm.
So we did a couple rounds of that and still nothing. And then she's like, hey, let's just dive right into like IUIs. So we did a couple rounds of IUIs. So that was about, I think, 2 rounds of IUIs, with just the Clomid. Didn't take. So we did another 2 rounds. She switched the protocol. It was now moving on to the injection. Now this was years ago, so I don't even remember what she had me on. Didn't take. And so at that point, I was just feeling really, really stressed out. And I'm an anxious person, just like on a normal day. Like I've struggled with anxiety since I was a kid. So that just, I was stressed. I had major anxiety. And I thought, oh my God, like we're never gonna get pregnant. Um, and so like everything just moves so quick in Edmonton. Like it's just like bam, bam, bam. Like she didn't give us any breaks. And she's like, well, I just don't know why you can't get pregnant. Everything looks good here. Let's move on to IVF. And we thought, okay, like for sure, like something's going to take.
Mm-hmm.
But anyways, so went through first round of IVF and it did not take. So we had, I think it was 10 eggs retrieved from me. And, by time they go through the process, they let them sit for like 3 to 5 days just to develop. And ours were always 5-day embryos. Well, we ended up, I think, with just 2 and none left to freeze. So let's transfer the 2. Yeah, okay. Didn't take. So at that point, it was just, I, I didn't even know what to do from there because it was just like devastating, right? Like, man,
Yes.
IVF didn't even work for us.
Mm-hmm.
So we just started thinking like, what are other options kind of thing because surely this is not gonna work for us. But anyways, we go back and have a discussion with the doctor and she says, hey, let's do it again. Yeah, yeah, I know, right?
Find yourself a
And
doctor that's just willing to do it all.
oh, I was scared of her actually.
Oh my
So like she was
gosh.
terrifying. She was just so out there and just like dominating in that clinic. And so we're like, okay. So this time she changed the protocol, like completely different meds. Everything was different. So we're like, okay, let's do this. She actually ended up overstimulating me. So basically we had 23 eggs.
Oh
Yeah,
my Lord.
20,
That's a
23.
lot.
Yeah. And so I was very uncomfortable, overstimulated. And so we couldn't do a fresh transfer. So I think like by the end of that, like getting all those eggs out and, um, just letting them sit, the embryos turn into, they wanted them the 5-day embryos, so the chances were always better. I think we ended up with 4 to freeze. So we had no choice but to freeze them. And I thought, okay, well, this is good. Like, I need time. Like, this is just too much. I'm too stressed. I can't, like, I literally just need time to not be at this clinic because you're up in the clinic every second day, almost daily, right?
Wow.
Yeah, and in the Edmonton clinic, they really did not want to give you time off. So I was trying to work full time. Thank goodness work, like they were so good at just, okay, like you can have the time off, just go get this, whatever. I think I ended up going off on stress leave because I was just too stressed about what was going on with that and trying to work full time.
And too, all
Um,
the hormones that she's giving you and
yes,
all of
and
that, right?
overstimulating me, right? So
Yes.
it's a million times worse. So anyways, they, yeah, retrieved the eggs. We ended up with, I think, yeah, 4 to freeze. So then I had to wait a couple cycles to go in and do the transfer until my body calmed down. So we go in a few months later and they give you the option in Edmonton if you want to transfer 1 or 2. And we said, oh, like definitely 2, we'll do 2. Transfer them in and, I got pregnant. So anyways, we go for our first ultrasound. Um, the ultrasound tech was like labeled. We had, oh, you got two in here. We got the baby A and baby B, and it looks like one of the embryos split. So I didn't actually get pregnant off the two embryos. One stuck and split.
Oh my goodness.
Yeah. So we were like, oh, we knew this would happen. We weren't surprised to see that there were twins there, but during the ultrasound, the tech, she's like, oh, I'm just gonna be right back. And of course, I always like, oh, what now? What?
Yeah.
So she brought the doctor back, and she said, okay, well, you got one really good, strong heartbeat here, and unfortunately, the other one is just not carrying on with the heartbeat.
Mm-hmm.
And so we thought, okay, like, it wasn't really devastated that, there was what, because it was so early on, right? Like, let's just focus on this one baby. We got a strong heartbeat.
Yeah.
We were very excited because we had been through, you know, all that 4 rounds of IUI, and this was our second round of IVF, and it was just a lot. So, yeah,
Yeah.
she come out a healthy baby. She's 10 now. Kendall is her name. So we were very excited to have her. She was the best baby ever. But anyway, so those frozen embryos we had left over, we just kind of like kept paying for the storage each month, or year. No, it's per year, until we were ready to go back. So then I think Kendall was 2. I think she was around 2, and we thought, oh, let's do this again. Like, we didn't even try on our own to get pregnant. We just called the clinic. We're ready to go again, kind of thing. We didn't want the stress of trying naturally and not getting pregnant.
Yes.
So we go back, and yeah, so they get you going on your cycle. They start you, on all your meds, your injections, and everything to get your body ready for that frozen transfer. So then they said, this time, do you want to transfer 1 or 2? And I said to my husband, I'm like, oh man, like, oh, I think just 1, because I know I'm going to end up getting pregnant with twins this time, and we already have
Yes.
we already have a healthy baby. I don't want 2. And I mean, previously, I just felt like your chances were better when you transferred 2, right?
Mm.
Although they actually weren't, but so yeah, we just went with the 1, and I got pregnant. So I just could not believe how easy it was, that, oh, we go back, we call them, and, they transfer this embryo, and I got pregnant. But we've been through so much. We're so lucky that, I got pregnant. But anyways, I was just about 12 weeks pregnant, and I ended up miscarrying that one. And so I was like completely devastated, because that was an IVF baby too. Like, like, we went through all this to get this baby, and now this baby, I've miscarried this baby. And I ended
Mm.
up in the hospital over it because I just was bleeding so bad. So anyways, you go into the fertility clinic after that happened just for a follow-up. And the doctor, she's like, yeah, like, and I know it's devastating. A loss is a loss, but why don't we, like, are you ready to go again and do another round?
Oh
And I
my
just thought,
goodness.
I know, right? Like, you've been through so much.
Yes.
And I just actually at that point, so up until then, we were under the classification as unexplained infertility.
Okay.
But anyways, after I had that miscarriage, I really was like showing major symptoms of endometriosis after that. But the very first thing that the doctor should check, or that they tell you they check for, is they usually give you that laparoscopic surgery for endometriosis to see if any patient has it. And they didn't do that for me right off the get-go, right? So
Mm-hmm.
actually, all this time, I had a misdiagnosis. So it wasn't until I had that miscarriage that she gave me that surgery, because I said, like, I'm in pain all the time, and my periods are long, and this and that. And I said, I think I have endometriosis. Oh, well, when did I give you the surgery? I said, you didn't. So, and this is already a few years in, right? So she missed that completely right off the get-go that I had endometriosis this whole time, and that was actually what the problem was.
Yeah.
But anyway, so we took a break. I ended up getting the surgery and just kind of healed, gave it time to heal, and then um, we did another transfer, but that transfer didn't take. So we were all out of embryos. So at that point, I just kind of said to my husband, like, I'm done. I don't know. Like, we have a beautiful baby girl. We kind of just like accepted that she was going to be our only child. And, like both of us were on the same page. But then as she got older, she was like, I want a baby brother or sister. And, she actually looked quite sad
Oh.
all the time about it. So it really just kind of started weighing on us. So at this point, she had just turned 4, I believe. So, anyways, we actually ended up getting a call from the fertility clinic in Edmonton saying that they are closing. We need you to come in for just a consult. What do you want, like basically what you want to do with your chart, where you want to move your chart to. And so we go into that appointment and the doctor said, like, okay, like we'll just take your chart to Calgary or you can go to BC kind of thing. And we're like, just send it to Calgary. We're not really like right now doing anything of it or with it.
Mm-hmm.
So they sent it to Calgary and then I think Calgary actually contacted us and kind of just mentioned that, hey, if you want in our clinic kind of thing, we want you to go to, it was basically, I think it was an evening. They want you to learn about IVF and the process and everything, but you actually have to go to this just before you can even be a part of their clinic. And this was years ago again, so I don't know what it is now, but there was just this learning session. So it was summertime and we were kind of camping close to Calgary and we thought, let's just go into this session kind of thing. So we got that done and then we left there and we both were like, should we, like, maybe we should just give this one more go. Yeah, okay, called Calgary and like that clinic, I feel compared to the Edmonton one, we were just, it was so different. The environment, they were also like welcoming and you were actually a patient, whereas in Edmonton, you were a number and it's like, get you through, let's get this going, let's, how many times if it's not working, let's just keep you going. And, it just, I felt like there was not a lot of compassion there.
Yeah. Yeah, that's kind of the vibe I was getting when you were even explaining. There was
Yeah,
no breaks and it seemed like no empathy for your situation
right.
or
Yeah.
discovery into maybe why this is happening.
Exactly. And then just not even like I was driving 2 hours, every day, every other day. And oh, you don't need time off work for this. Like, why wouldn't I? You know?
You're like, do you
And
understand how
so,
far I'm driving?
and so she never ever wrote me a note to be on days off. So it was just like so
Wow.
stressful, the whole environment there. So anyways, we go to Calgary and we get in and we start talking about a protocol or whatever, how we're gonna proceed. Because I have to go through, like I had no frozen embryo, so I have to go through another egg retrieval. So this would be my
Mm-hmm.
third egg retrieval. And um, I understood like everything and because we've been through it so many times, so it was easy. Okay, we get going and I get there and they say, okay, like, basically you have to stay here. You're going to have appointments. Like you have to stay in Calgary. You can't go too far, which luckily I had a sister right outside the city. So I stayed with her for 2.5 weeks and my husband was kind of back and forth with my daughter. He only came up when he was needed, but, um,
Yeah.
it was so relaxing. Every appointment that I had, they were just this is the kind of, lab we want to see on all our patients. This is like, you look great. Like this protocol we have you on, everything, because you're having internal ultrasounds every other day to see the embryos grow or the eggs growing inside you, right? And yeah, so it looked really good. So I was never stressed out. I was like calm as a cucumber the whole time. I go to my appointment, then I go hang out with my sister and my nephew and my niece, and we would just like go for walks and whatever. And it was really no big deal. So come the embryo transfer, so they actually ended up, we had again like quite a few eggs come out of me. I'm pretty sure there was like 23 some, but they didn't overstimulate me. Like my body was fine.
Mm-hmm.
So I think by the end of it, we had three. Yes, so three that we could do a fresh transfer, they said, and then we can breed two. So I said, okay, so we'll do this fresh transfer, and they recommend, like they tell you in Calgary, they say whether you're transferring one or two. So they said, okay, one, your embryos are great. They made it to day 5 embryo, no problem. So this whole time I was so excited. I was like, oh my God, I'm going to get pregnant right off the get go.
Yeah.
And yeah, it took. And I got pregnant and I have another healthy girl. She's now 5. But it was like, I don't know, the clinics were so night and day. Like just if I had to do it all over again, I absolutely Calgary all the way. Like they were just so welcoming, compassionate. They just always updated you on how things were going, which I never really got a lot of that out of Edmonton. Plus they misdiagnosed me. So my husband, he was just like, I don't want anything to do with Edmonton. But yeah, so
No kidding.
yeah. But
Did she do anything after that surgery for your endometriosis or
no, so I
no?
had the surgery and she put me on a couple meds after just to kind of like, she didn't even end up taking all the endometriosis. She had left what was on my bowels because she said, oh, I didn't have my tool with me. And I feel like that was where it was the worst. Like my symptoms after the surgery, I was still in pain. My symptoms never really went away. So I thought, what the heck? So she gave me a kind of, I can't remember what she gave me, but it was an injection to kind of just like suppress the endometriosis. Well, it made me feel so shitty. Like I had headaches all the time. I was tired. And then all she said to me is like, okay, just stop it then. But after that, yeah, I had really nothing. She did nothing after that. Just kind of left what she had said and that was it. So I just feel like, yeah, we were left in the dark with a lot of it. But even so, we went to Calgary and they're like, because I kind of expressed my concern, like I had surgery for endometriosis. She didn't get it all and blah, blah, blah. And they said, you know what, with IVF, it really doesn't matter. If you're doing IVF, it doesn't matter if you have the endometriosis or not. We're, basically putting you on hormones and we're making your body what we want it to be for a transfer of an embryo. So, yeah. But all that time, we went through 4 IUIs, like before the IVF, and she just put us on a fertility med without even investigating the whole endometriosis thing, which she had said that is the very first thing we look for. And I didn't know it at the time because she didn't tell me that until after I started saying this is how I'm feeling, which I didn't really have a lot of those symptoms before my miscarriage. It's weird. Like the miscarriage really brought out a lot of pain and like inflammation and stuff like that. And I was just like, oh, something's not right.
Yeah, and for her to be like, "Oh, when did I give you that surgery?" and you like, "I've never had anything done."
Yeah, I said
And
you didn't. And she was like, oh, like nothing was ever that doctor's fault though. Like she was scary. I did
and like
not
you
care.
said, you were just a number, and I think that reiterates that
Yeah,
that you're
yeah,
so busy, and I feel like I personally have never been through IVF, but even seeing friends
Yeah,
and stuff that have, and it's like if you're having an IVF doctor, you need them to be as invested in your journey almost as you are,
exactly.
and really
Yeah,
follow you, like dot all those I's, cross all those T's.
yeah.
And you're putting these women on such intense medications in regards
Yes.
to their hormones and stuff. And just to be like messing with that, not to mention like the financial aspect of it all and the
Oh, yeah.
retrievals that women are going through and then freezing the eggs and storing them and stuff. Like it's not,
Yeah.
to me, just this simple thing that we're doing to try and
It's
get
not.
these
Yeah,
miracle babies, right?
yeah. And lots of people don't even go through it because it is so expensive, right? Like,
Mm-hmm.
we were very fortunate, but yeah, you have embryos that are being stored. You're paying, I think, 300 and some dollars a year. And actually, the price has increased to double. I think it's 600 and something now to
Yep.
store that per year. But yeah, and not only that, I just
Yeah.
feel like back to the whole, I felt like I was just a number in Edmonton. Your waiting time, you would get to an appointment and you would wait for 2.5 hours before you'd even see the doctor or go in for your ultrasound and blood work and all that. But in Calgary, you go in for your appointment and you're there. Like they take you in at the right time when your appointment is up. And like I really did not have to wait around there. And I just felt the whole experience from Edmonton to Calgary was two completely different experiences.
And I wish that everybody could have the experience that Calgary
Yeah,
gave you.
I do too. And that's what I
Like,
tell
yeah.
a lot of anybody who asks me. I say go to Calgary. They were so wonderful there. They
Mm.
treated me like so kindly. They said, no, like you have to be here. Here's your doctor's note. They just always, even the doctors, they always took the time to explain things to you because you didn't necessarily have the same doctor through every appointment, right? Like you're in there every other day and then up to the transfer, you're in there daily. So it's whatever doctor's in the clinic that day that you get. And yeah, they just were all so kind and would explain everything to you. Where is like Edmonton, you're in and out, you're in your ultrasound, and then okay, the doctor's out, and that's it. Like, okay, well, what's going on? So
Yeah. And I want to think that maybe it's a very intimidating experience too. And you have so
yes,
much of yourself
very.
invested, right? And yeah, to
Hmm.
be left in the dark, like nobody in their medical care wants to be left in the dark. And especially something like this, like that's the sole thing you're holding on to is to get those two pink lines. And you're like, okay, well, where in this
Exactly.
journey are we at? Like,
Yeah,
um,
and it's like so emotional too, and it's just like, yeah, you were just a number in Edmonton, and it felt that way, you know.
oh.
So
And you
yeah.
probably feel that even more too after you got like a very positive experience.
Yes,
Hey.
exactly right. After, yeah, because I have another place to compare it
Hmm.
to, and I have a baby from Edmonton, I have a baby from Calgary, and still, like 100,000 times over, I would go back to Calgary over. I mean, I know Edmonton's privatized now. I don't even know where their clinic is, but they
Hmm.
just kind of, it's not, they don't run that one under the Royal Albert anymore.
Probably for good reason.
Yeah, yeah, that's
I
right.
know. I'm trying to think of what the one place is called that my one girlfriend went to. I think she went to a clinic in Saskatoon and a clinic in Edmonton because she similar experience. The embryos just were not taking.
Yeah.
And so she kind of like looking for second opinions and things like that. But I can't remember exactly what the clinics were called. What was the egg retrieval process like for you?
Okay, so egg retrieval, I know lots of women who go through the egg retrieval process say it's actually horrible for them. But I actually, my all three experiences were wonderful for me.
Mm-hmm.
They gave me, of course, like some fentanyl, a little bit of midazolam, and they're like,
That
okay,
helps.
yeah, we're gonna give you this drug called fentanyl. I'm like, yeah, yeah, I know, I know what
I
it is.
kind of do that for a job. I know my medications.
Yeah, and so yeah, they retrieved them all and it was really quick. Like I wasn't completely like out of it. I kind of would like sleep a little bit or, but you're still aware of what's going on and it wasn't ever painful for me.
Mm-hmm.
And all 3 times, yeah, it was great. It's just after the egg retrieval, I remember, with all the meds, you're so tired, you go home and you basically sleep the rest of the day.
Mm-hmm.
I wasn't in any pain after, nothing like that. It felt good to get them out because I had 23 eggs in there.
No kidding. Oh my goodness.
Yeah, so it's just basically, yeah, my egg retrievals were smooth and it was just kind of a lot of rest after and just make sure you're drinking, they said Gatorade just so that you don't get dehydrated and, water and all that sort of stuff. But yeah, mine were never, I remember talking to another woman and she said my egg retrieval was horrible and that she was in so much pain and the whole thing hurt and I thought, oh my gosh, no, they medicated me well.
Yeah, no, majority of the stories I've heard is that it was very uncomfy. So I was
Really?
curious to see what your
Yeah.
take was. Yeah.
Yeah, never for
Hmm.
me. They all seemed to be a breeze and honestly the egg retrieval was like the least of it for me.
That's
Yeah.
amazing.
Yeah. So, mhm.
I'm very unfamiliar with the difference between like I kind of know the difference between IUI and IVF, but
Okay.
what's the difference in the processes? Like when they I don't know if I'm gonna say this correctly, but like do the insertion of the
Oh, yeah.
embryo.
So with the with the IUI, so they're actually not taking the embryo out of you, right? Like, so you're just on these meds, you're gonna ovulate, and then when we did do the injections, you're gonna inject to drop your eggs. So that's what you do, and then you go into your appointment. Your husband will go into a separate room and do his thing, and
Yep.
then they kind of clean up the sperm and all that, and then they just basically with this large catheter, they just suck the sperm up in there, and then they inject it right into you, and then you just lay in the room after for like 20 minutes, and then you're free to go, and that's it.
Oh, okay. Yeah.
Yeah. So with IVF, right, they're actually taking the eggs out of you, putting the sperm with the egg to
Hmm.
make the embryo, and then putting it back. So yeah,
Oh,
and yeah,
okay.
those
Did you find
the
the process quite different then versus the IUI, the IVF when they were like doing the final portion of it?
Oh yeah, yeah, it's a lot more because with the IVF, you are actually in like one of their OR rooms, and everything very sterile. They
Hmm.
hand the embryo to the doctor, like in the catheter, right at the right time, like so it's just they can't be exposed out, right, like with air for too long or whatever it is. I'm not sure, but yeah, it is actually quite a bit different experiences because with the IUIs, we were just in a doctor's room, like a basic room where, okay, let's just get this in you and
That's
here you
crazy.
go. Yeah, lay down with your legs up for 20 minutes. Okay.
I feel like if IUI works, it's like, oh yeah, I just got pregnant in the doctor's office. Like,
Right? I know. And like a lot to do. Like they're successful with that and I think that's maybe a
mhm.
lot of the unexplained ones, but the whole time I had endometriosis and didn't know it.
Yep.
So it just
Yeah,
yeah,
between 10 years ago and today, I feel I've heard of a lot of progression, and it might be doctor specific, but
yeah.
of people willing to really take the time to investigate it, treat it, and
Yes.
hopefully treat it in full so that these
Yeah.
women aren't in all this
Yeah.
pain, whether or not you're still in childbearing years or if
Yeah.
that's still your wish, but just the pain
Right.
alone. Like, one of
That's
my
right.
really young girlfriends just had to have a hysterectomy
Oh
a
my
couple of months
gosh.
ago because, yeah, it was bladder, bowel,
Oh
so much pain. She had been bleeding for, I think, 3 months
my
straight.
gosh.
Um, and it took her a long time to have something done.
Yeah.
And she said since she's had it done, no bloating, n- no
Right?
pain really, but it's just they left her ovary. So it's like the hormones are kind of a roller
Okay.
coaster right now.
Yeah.
But yeah, at 30 years old having
Yes,
to have a
very
hysterectomy
young.
because of it.
Yeah,
Yeah.
yeah,
And I think if they would have had the option to have another baby, it would have been there. But I mean, they
yeah,
struggled with infertility for years and never ended up having to do the IVF, but they were signed up to do their consultation and just ended up getting pregnant. But
yeah,
yeah, for years and years, almost the same timeline as you,
yeah,
and just
yeah.
sitting there in all of this agony and like the amount of blood these women are losing
Oh,
and just,
right? Yeah.
periods are bad enough, let
Yeah,
alone
exactly.
adding
Yeah.
all of that on top of it, right?
Yes. Just all the
It's
things, anything that women
yeah.
gotta go through, like it's, yeah, it's a lot. And so, oh gosh, I know I really feel for anybody who goes through any of that because it's just like, I mean, I like looking back on my journey and see where we are. Now we have our two healthy babies, but
Yeah.
it's just like, it's a lot. And some people don't even finish going through the fertility treatments because, I hear a lot of couples that, actually end up getting divorced over it and I believe it because the stress level is ridiculously high. Like I remember how I felt. It was just constant. Like I had such bad anxiety. My chest hurt every single day. I couldn't think of anything else. Like you just couldn't do your day to day life because,
Mhm.
you wanted a baby so bad and you don't have one.
Yeah, and I believe that if you aren't put in a situation where, so I feel like we look around and it just seems like people are just getting pregnant all around you. And
Yeah.
I'm sure that's even
Yes.
like escalated if you are struggling.
Oh
And
my gosh.
like
And
you
then
said,
yeah.
unexplained, even though you had a
Yep.
reason. But all
Yep.
these women that are like, oh, it's unexplained, we don't know why. And
Yep.
as a woman, I think we have so much pressure on ourselves
We
if
do.
children are in your wishes for yourself, but
Yep.
so much pressure just to get pregnant, have the baby, and
Yeah.
you
That's
grow up
exactly it.
thinking, yeah, it's going to be this fairy tale, it's going
Yeah.
to be
It's gonna
easy.
be easy.
As soon as you decide you want it, it's going to happen. And
Yeah.
the older I get and
Not the case.
the more I know of women trying to have babies, the more I see that
Yeah.
that is not true at
Yeah.
all. It is not
That's
easy
right.
to get pregnant, stay pregnant, and just have a simple delivery.
No. Exactly. And yeah, we had been through so much and I'm like I know people, they genuinely care and they they want to help, but it was like, those comments like, "Oh, just relax. You're gonna get pregnant or go get drunk and you're gonna get pregnant and this is what happened for me." And I'm like, "Yeah, but everybody's so different. It's not gonna necessarily be the same." And so yeah, it was like I get these people trying to help, but you're making it worse.
I know it's so hard to find the right thing to say in those
Yeah.
moments. And then, yeah, it seems to always come from someone who's ended up getting successfully naturally pregnant. And you're like, no
Yeah.
amount of alcohol is going to get
Yeah,
me
right.
pregnant at this point, actually.
Yeah. Oh man.
Oh my gosh.
Yeah.
So when you decide to be like done, what are
Yes.
your options for the eggs that you have stored?
So when you decide to be done, you can either donate them, um, or you can destroy them kind of thing, or you can just keep freezing them, I guess, for however long you want because they freeze and if you want to, do it again down the road. So those are kind of your options, with that, I guess. Yeah.
Okay. Um, What would be your biggest piece of advice for a woman, whether or not they're considering IVF or they're in the thick of it and maybe it's not going as planned? What would kind of be your biggest piece of advice for them?
Um, I would say, just keep going. That's what we did. We just kept going even though we felt defeated. I would
Hmm.
say talk about it. You cannot bottle this in. And I always needed to talk about it. What I was going through, I would just, I would tell my friends, this is what's happening, or,
Hmm.
my mom or anybody, because you do feel so alone. But I find that if you talk about it, you feel less alone. plus you might meet somebody, who's going through this exact same thing as you, and you can kind of talk about your experiences. And then I think it actually takes a little bit of a weight off your shoulder. I would say definitely talk
Mm-hmm.
about it. Yeah. And keep
Yeah,
going.
keep going. I love that. Yeah, I feel like it can be one of these things that you can almost feel ashamed, I guess, is a word I've come across, is that, oh, my body didn't just get pregnant. And so now that this
Yes.
is my journey. But
Yeah.
I mean, I think that there's more IVF babies around us than we maybe
There
necessarily
it
know about.
Right. And I do hear that more now too, that my kids are older, because I'm like, oh yeah, like my babies are IVF babies, and you get the odd person saying, same, and it's like you had no clue that,
Yeah.
these other people went through that too. And it's just like, it's mind blowing the amount of people that have been through it.
Yeah.
Yeah.
And like how incredible that medicine has come this far to be
Yes.
able to help these moms
Yeah.
become moms.
Yes.
I
And I
think it's
mean, now,
so
like,
incredible.
It it is. And yeah, it's just, yeah, the science out there and what they can do, it's unbelievable. But yeah, my journey, like, it's been quite a few years now, and I mean, I don't necessarily remember every single detail about it
Hmm.
anymore, but it's there, it's part of my life, and I just
Yeah,
kind of actually embrace it, because
I love
I
that.
just feel like even though we went through all those hard times, yeah, we have two healthy girls, you know? So it's just,
Yeah.
yeah.
And I
And
think
if,
it's important to normalize like the hard things that you went through and still appreciate that they're here, but hold space for all of the hard things that you did go through.
yeah.
You
And
know, those just don't vanish because the girls are here.
that's right, exactly. And I
Mhm.
just even remember going through that miscarriage. I was done after that. Like, I just felt like I can't go through this. That was the most devastating thing ever to go through. And, aside from even IVF and IVF not working, but I had a baby growing in me, and I lost a baby. And Kendall was, like I said, I think she was 2, almost 3, and she just didn't even understand, what was going
Mhm.
on. And it was hard to, you know, try and look after her and try and tend to myself with my feeling sad, that this happened. But yeah, just like,
Do they know why you miscarried?
no, so the
No.
baby really just wasn't growing.
Oh,
Um,
okay.
yeah, so I'm just assuming that there was just something genetically, right, that didn't
Mhm.
why the baby didn't carry on. 'Cause, yeah, it was, 11 weeks, but they said his size, or his he
Yeah.
size, was really no bigger than a baby that was 8 weeks.
Okay.
Yeah.
Um, yeah, were you able to find out the genders of your embryos? Is that like an option?
No, so that's not really a thing in Canada.
Okay. I feel like
I
I
hear,
follow so many people from the States. They're like, we
yes,
picked the genders. I'm like, really?
yeah, that's not a thing here. But yeah, I've heard that too, that you can pick the gender in the States, so that's kind of cool. But at the same time, the surprise is nice, right? Like, you're just like trying to
Yeah.
transfer an embryo and hoping it sticks. So I think, just
Yeah.
let
Gender doesn't
alone
matter if you
the
see
gender, no. Yeah,
that.
exactly. Oh
That's
man.
so true. Trying to think if I had anything else. Hmm. Yeah, I feel like, yeah, miscarriage is such a hard thing for me to wrap my head around. So
Yeah,
unfair.
it is very unfair, and I mean, I know lots that have had several, right? They
Yeah.
just couldn't.
And when
But
there's
yes,
no rhyme or reason behind it,
yeah, yeah,
yeah,
yeah.
it's almost, I don't know if everyone feels this way, but I do. It's almost easier to have a reason at the end of the day
I agree. Yeah,
rather than just sitting there and be like, we will never know. And two,
yeah,
like you were so close to that 12-week mark and,
yeah.
you
And we were
know,
getting excited, right? Like,
mhm,
oh, so close. But at the same time, I really felt like,
yeah,
okay, so why am I like not as tired anymore? Why am I not feeling sick anymore? Like, knew something was off, but it just, yeah,
Mm-hmm.
happened that, and I wasn't
I know.
like, I wasn't really bleeding or anything at that time. It was just like some funny tissue was coming out, and I was like, oh
Oh,
my
okay.
gosh, like what
Yeah.
the heck's going on?
Did they have to
Yeah.
give you medication? You said you ended up in the hospital from bleeding so bad?
Yeah, so they hooked me up to oxytocin
Oh,
and just admitted me overnight, and I was in a lot of pain. And like, oh no, we'll give you some morphine. I'm like, I don't want morphine. I'm good. Like I
yeah.
felt like the pain of that miscarriage was worse than labor, and I don't know if it was because I knew the end result that there was no baby, right? Like
Mm-hmm.
I just felt I was in so much pain, and because I went to the hospital, he did the ultrasound, and he said, "Oh, there's no heartbeat, so you can go home." But it was literally that night. I remember like just laying over the bed, and I'm like, "This can't be what a miscarriage is like." Like the pains were worse than labor pains, and I thought, "Oh my God, like I gotta get back to the hospital because I can't even stand this." And then all of a sudden, the blood just
Mm-hmm.
started gushing out, like really gushing out, and so yeah, I don't know if that's just me because after I had my first daughter, like I had hemorrhaged after having her and I lost a lot of blood, and so I don't know if it's just what my body does, right? But
Yeah.
yeah, so I had to be admitted, and then after that I was in there for a day. They kind of got things settled. I had passed the fetus and everything, and then I went home and they gave me some misoprostol just to
Mm-hmm.
kind of get the rest of it out. And again, that actually gave some pretty hefty contractions. I thought, oh my gosh, like, and it was just devastating because, like I said, the end result is not a baby.
Yeah. And yeah, it's devastating enough to hear there's no heartbeat or baby stopped growing.
Hmm.
And
Hmm.
then you have all the emotions with that. And then the
Yeah.
physical and the passing
Yes.
of everything. And
Yeah.
oftentimes, I mean, you are sent home and you're like, oh, you'll
Yeah.
just pass it at home. And
Oh,
like,
I couldn't imagine anybody that does that at home, but I mean, I guess everybody's
oh,
circumstances are so different, right?
yeah. And how
So,
your body responds and
yeah,
things like that. But even the amount of stories I've come by on socials and things like that of people passing it at home and then they end up in the hospital with
yeah,
adverse outcomes because they weren't being appropriately monitored. And especially, um, is the misoprostol the pill?
yeah,
Yeah,
yeah.
with
So
that,
you
I've
actually,
heard
yeah, yeah. It's yeah. Actually,
much.
I
Yeah.
ended up stopping it after a couple days. I remember because I remember saying to the doctor that I'm like, this, I can't even do it. Like it hurts.
Hmm.
So, yeah,
Yeah, it's a very unfortunate and unfair thing to
very, yeah.
have to go through. It just breaks my heart. And I feel
I
like too
know.
and I especially felt this with my first pregnancy, and it obviously dwindled the more subsequent pregnancies I had, but the first thing is like that 12 weeks and you're like, "Okay, if I make it to the
Mm.
12, I'm good." And then,
Yeah.
it's just there's
Mm.
never any safe zone, and I guess we still
There's no,
have to have those goals for ourselves to get us through it, but and
yeah,
then yeah, to go well, it would have been your first ultrasound and you
yeah.
just wait for that moment and then
I know. And then
yeah.
there's no heartbeat. Yeah. Well, with actually IVF, you actually have quite a few ultrasounds early on. So you usually get one at about the 7 weeks, and then so we had seen the heartbeat, we had seen all of that, and then there was none, and it's just like yeah, it's just devastating. But then when I with my
Mhm.
second girl, when I did get pregnant with her, that is what I worried about the whole time, the whole pregnancy. It didn't matter how far along I got. I thought, oh, okay, is something going to happen? And I did start bleeding with her at 14 weeks. And I just thought, oh my God, here we go again. And
Just
no,
triggers
like,
a whole nother
yeah,
realm of anxiety, hey?
yeah, yeah,
I know I really miss that blissful outlook on pregnancy and once
yeah,
you and I know we hear about unfortunate outcomes everywhere around us, but
yeah.
I never truly believed that it would be me. And then once it
No
is, and if
way.
you decide to keep trying again, it's all I think about.
Yeah. But
It's
how do
like,
you just even from that, how do
yeah,
you move on from that?
yeah.
Like,
I even
you just,
struggled like holding on to the happy moments because I'm like, okay,
oh,
yeah, this is like a really big high, but I could turn a corner and then there could be a really big low, and then that's going to feel even lower than maybe, so
yeah,
it's a heart game, it's a mind game, yeah,
yeah,
it's kind of all over the place. Um,
yeah.
is there anything else that's like burning on your heart to share about your story, or how are you
Oh,
feeling?
this is great. I mean, honestly, it's been years since I've talked about this because, like I said, my kids are, they're getting older now and stuff, but I've really enjoyed this because I'm like, it kind of brings back some memories of what you went through, but it just,
Yeah.
yeah, just,
And I think
I
it's
feel like,
important too because it's been so many years, just to show that no matter how many years that have passed, it's still
yeah,
important to talk about and honor
yeah,
that very much. That's the reason your girls are here, right? And
exactly. And if it helps,
unfortunately, as the years go by, it might not be becoming more common, but we just hear of more people doing it. And so the openness to
exactly.
talk about it
Yeah,
and,
yeah,
at some point accepting that this is kind of how your story played out, and
yes.
yeah,
And you know
giving it
what?
space, I think, is so important.
You're, you're right. And I honestly feel like, when I was going through it, it really helped me personally knowing that there were other people going through it and hearing their stories. And I feel like if this helps somebody, to want to just keep going, it just like, yeah, it just makes a person feel so good inside because, like I said, I've been there and
Mhm.
there ain't nothing surprising to me anymore.
I know. Right after we connected, I actually had a couple women reach out, and they are IVF moms, and they were like, "We just
Oh,
wish we had someone or something to listen to when we were going through
yeah,
it." And so it made
yeah,
me even more excited that you were
yeah.
willing.
Right? Because
Uh,
back then it was like I personally would meet these people, right? There was no social media wasn't even a big thing,
mhm.
so it was just to connect to women personally who have been through it. Just yeah, it's totally different than being able to, listen to a podcast or see it on social media or yeah,
Yeah, and I
yeah.
think even just people having the conversation around you, whether or not it's listening to this on your drive or,
Yeah,
scrolling your social media and just kind of giving you that comfortability to be like, okay, yeah, it is okay to talk about. And maybe if
yeah,
opened up a little bit, it would help. And I mean,
yeah.
I totally respect that not everybody is like that.
Right.
I am very much like that. I could talk about this stuff all
Yeah,
day, every day.
yeah,
But just, yeah, like you
exactly.
said, to help that one person and, yeah, just create some normalcy about talking about it. I think are doing that in many different
Yeah.
aspects of
And I
life
mean,
these
like,
days.
yes, and even though you feel like you are alone when you're going through it, you are not,
Hmm.
and that's my biggest thing. That is why I talk about it. It's because it just helps,
Yeah.
it helps.
Yeah. And I think too, we often sit and we're like, well, nobody is experiencing the same thing or my situation's different. And I
Right.
think we can also learn from different experiences. And your
Yeah,
experience is obviously quite
100%.
different than someone else's, but just taking those pieces and,
Yeah,
well, how did you cope with this? And just offering a different outlook
yes.
on it, I
Yeah,
think is so important too. I mean, they don't have to be the exact same story and they're never going to be. And I
right?
think there's beauty in that too. Hmm.
I do. I agree with that. There is beauty in it. Everybody's so different and unique, and it just, yeah. I love hearing different stories and how, they got their precious little baby, and yeah, it's
Hmm.
truly an amazing thing, honestly.
I know. I always often look at my kids and I'm just like, you're literally miracles, no matter how we got you or how you came to
That's
be or how you
right.
were born. I'm like,
Yeah.
these little precious babies, they're so
Yeah.
special. Well, thank
Well,
you.
and I'd love to oh, sorry.
No, go ahead.
um, I love to tell Kendall, that she was an identical twin, because that's pretty cool. Even though that one baby didn't carry on, it
Yep.
just Oh yeah, and I couldn't even imagine because Kendall, for her age, is so tall. I thought, oh gosh, if you had a twin, like normally twins are smaller. But
That's
yeah,
so crazy.
pretty fun. Yeah,
And I think it's
yeah,
special for her to know that too. I'm like, regardless,
yes,
like that was your twin. And
yeah,
I'm not a twin, but every twin story, I'm like, they are literally a part of me. Like they are
right,
the other
yeah,
half. And I think that's an important, yeah, thing for her to know about our story. And
yes, I think
oh,
so too. Yeah.
and I want to circle back too now that we're talking about that. And you mentioned something about um, putting two embryos in doesn't necessarily guarantee a better like chance.
Nope.
And I personally have always thought that, oh, people do too, so that they'll have twins or to give them a better
Yep.
chance that at least one will stick. And so it was very interesting to me to hear you say that that's not guaranteed, you know?
Because sometimes it's like if the quality of the embryo is not
Mm-hmm.
that great, they'll want to put two in, right? Like, because what if, like, it just, yeah, I guess your chances might be a little bit better, but that's just not necessarily the case. Like, people that want twins or whatever, well, yeah, let's put two in, but no, that's not like your chances aren't necessarily better, that you're going to
Mm-hmm.
get those two. So, but yeah, I did like in Calgary how they told us how many you are transferring, right? Just because of the quality of
Yeah.
them. And so I just right from the get-go felt like, oh, they got me. Like I can completely trust these people. So
Yeah.
yeah,
And that's what you need, right?
yeah,
The last thing I want to mention is, all of this, how far medicine has come in these IVF. And I really hope that one day our government can catch up and help out financially.
yes. Isn't that the truth? I like it is such
Yes.
a huge expense. I mean, I guess you get
Yep.
you can claim it through taxes and stuff. And I was lucky enough, like some of my health spendings account paid for like a small chunk of when we were at, because it's not just the IVF you're paying for. You got to pay for those IUIs as well. Like you're not, and
Mm-hmm.
you got to pay for all your meds, and it's just a huge expense. And I 100% agree. It should be something that is covered. There are people who want a baby so bad and they just can't. And
Mm.
yet you throw the expense on top of it. And again, there's certain people that just can't go through it because of the expense.
Yep. It
And
can be
that's not fair.
so far out of reach, right? And
Yeah.
not everybody
Mhm.
has the benefits with work of having
No,
those
that's
extra
right.
accounts. We're very lucky and fortunate, but
Yeah.
I mean, even that, it's not thousands and thousands of dollars to help
No.
out. And the
Mhm.
medications alone are so expensive,
Yes. It's
right?
very
So
expensive. Yeah.
I
And
seen
depending on
on,
your dose.
hmm yeah, dosing and how,
Mhm.
like, how long you're on these medications and how many cycles. And
Yeah.
um, I had seen on the news at one point when I went for a follow up ultrasound about Ontario possibly including it in their healthcare. Or
Oh, really?
portions, yes.
So,
I have not
maybe.
followed up since. It was just a little
Yeah.
clip that they had on the news, but I need to look into it more. But I texted my one girlfriend who's been through multiple rounds, and I told her that because that's what she always said too. She said, "Thank goodness we can afford it."
Yeah.
Um, but it's hard even if you can afford it.
Yeah.
And that, yeah, she goes, "Well, Alberta needs to catch up.
I
If
do.
that's what we're
And,
out here doing, we need
yeah.
to all try
And
and do it."
the cost is much more than what I even went
Mhm.
through it. And like every egg retrieval, you know, it was sure it was almost close to 10 grand, but then you have your meds on top of that and all
Mhm.
that, and then you have you're freezing your embryos, you're paying for that, like you're paying for everything.
Yeah.
So
Yeah, it
yeah,
comes
it's
with a
just,
very hefty cost. And
and and every
when you
clinic
get to the
has
point
different
of,
prices.
yeah. And when you get to the point of like IVF or IUI or any of those things, it's like these families, everybody's deserving of a baby, but they want
Mm,
it so badly. And it's
they do.
often
Yep.
the families that offer the most love and would be the most incredible parents. And when
Yeah.
that, yeah, feels so far out of reach and, you know, getting pregnant and everything in that trying to conceive phase, um, when it's taken a long time, I know I found
Mm,
myself in a situation like, well, is it ever going to happen?
yeah,
Like,
exactly. And then
and
it just kind of feels like a chore, right? And
yeah,
you're like, this is
I'm like
how it's supposed
scheduling
to
sex at
be.
that point.
Yes,
I'm
yes,
like, no,
yes.
you need to come home now and you need to be able to do it right now.
That's
My
like
app
all
is
you
telling
need.
me. But yeah, you lose the fun. And then, my God, I was so exhausted by the time I got pregnant. I was like, don't look at me, don't touch me.
Right? Oh gosh,
Oh,
isn't that the truth? And it's
yeah,
funny that there's so many that go through that. And
yeah,
again, that's not just you thinking like you're not alone. Everyone is going through
yeah. I'm
that.
a firm believer in that. Well, thank you so much for taking time out of your busy life to chat
Absolutely.
with me. I really enjoyed this.
Yeah, me
Um,
too.
and yeah, I just really hope that, somebody who's listening can take this and take
Yeah,
little pieces from it at least. And
I agree.
yeah, I'm always here to chat
It's a
if
lot.
anybody needs it. I try to offer as much perspective as I can, but
No, it's
no,
awesome. I love that you're doing this, and I had no clue either. And
thanks.
Carly, had reached out to
Yeah.
me. You had that little post about
Yeah, I
IVF.
was
I'm like,
really
that's
happy that,
really cool.
yeah.
Yeah.
Yeah,
So
I'm really glad. I know I'm trying, yeah, to kind of touch topics that, are weighing very heavy on people and, you know, having
just
the,
relatable, right?
yeah,
Like
and like
you can't think
giving
that.
people a chance to, you know, weigh in on maybe what's weighing on them.
Yeah,
And let's break
that's
that
right.
down. Thanks for listening to this week's episode. Please take a moment and on whatever app you're listening to us on, press that follow button to stay up to date with all future episodes. If you or someone you know are interested in being a guest on the Beyond the Birth Story podcast or a sponsor, please visit our Instagram or Facebook at Beyond the Birth Story podcast and send a message or fill out that contact form. I would love to connect with you. As always, remember to be gentle, kind, and hold space for yourself when you need it.